Welcome to the FitMoney podcast, where we'll discuss something we all need through our entire life, financial literacy, but also asking the tough question, why aren't students learning it? Financial literacy is more than the math and a behavior we'll need beyond the classroom. So we're learning how we can help students, families, and teachers build a new generation of financially fit students everywhere. On today's episode, FitMoney Executive Director Jessica Pelletier sits down with pediatrician Dr. Arvin Garg and Alison LeBlanc from the UMass Memorial Child Health Equity Center to discuss social determinants of health as they include and consider poverty as a cause of health concerns. Together, they discuss the role financial literacy has in our overall health, how it can serve as a platform to support those in need, and their work on a more diverse, inclusive, and comprehensive healthcare approach.
Dr. Garg, Alison, I'm so excited for this conversation. Thanks so much for joining us today.
Oh, it's wonderful to be here. Thanks so much.
Thank you. We're really happy to be here.
So we are here to talk about healthy behaviors and wonderful healthy habits that you guys are working with and teaching children. But first, Dr. Garg, I'd love to start with you. You are a pediatrician and I know a professor, and you do such amazing work in the Central Mass Worcester area. Tell me about this new center that you have co-founded and how it relates to your work as a pediatrician.
Yeah, thanks, Jessica, for this opportunity. It's so great to be on this podcast with you and Alison. And this is our first one, so we're excited to do this together. I'll take a step back. I've been a pediatrician now for almost, I can do the math in my head now, almost 25 years. And it's just something I've always just loved to be around children and to work with them and talk to parents and try to promote their health and development. As a pediatrician, you can't not witness the impact that the social circumstances, the family, the home environment, the community that they live in, how it impacts a child's health and development and the opportunities that they have moving forward. And so inherent in every pediatrician, you know, we understand, we have to acknowledge, we have to understand the social drivers that influences the patients that we take care of. In the U.S., I always mention this, the poorest segment of the population you look by age is children. And that's been true since the late 1960s, after the enactment of Medicare and Medicaid. Disproportionately, children are growing up in poverty. Every pediatrician who's trained in the U.S. has taken care of a low-income child at some point in their career, either as a medical student, as a trainee, as a fellow, or in their practice. And many pediatricians take care of poor children on a regular basis. So it's a long-winded story to say, like, for me, I've always thought about the social inequities and the drivers for children's health and development. And we see it on a daily basis. And to really think about how do we improve the health of the children we're taking care of, it goes beyond giving medical advice. It has to think about a more holistic approach, to think about the drivers and barriers that these children grow up in. This is their child's circumstance, and there's disparities starting in day one when a child is born. And so we're thrilled to start this Child Health Equity Center. You know, since the pandemic and the killing of George Floyd, there's been a big focus and attention to health equity. I'm proud that Alison and I and many others have been thinking about health equity, and I'd say our field of pediatrics has been thinking about this for generations and generations. And so we have this special opportunity to start this Child Health Equity Center in Worcester, which is the second largest city in New England, and has great health inequities, has great strengths in the community that we're learning and partnering with. And our focus is to take a public health standpoint and a public health approach and use our voice and our privilege in medicine to try to do better for the children we take care of by innovating pediatric care, by making meaningful community partnerships, by listening to our community partners, by listening to our families to think of novel ways of going beyond the typical medical approach to promoting health and preventing disease. The two largest threats to children's health and development in the U.S. is poverty. As I mentioned before, the majority of children, or almost half of all children, live in low-income conditions. And then also racism. Since 2020, the majority of children in the U.S. are children of color. For our center, we're trying to dive into this work. We're trying to work on initiatives to mitigate these detrimental consequences of poverty, of racism, of adverse social determinants of health, new community partnerships, as well as thinking about really particular vulnerable populations within the pediatric population to partner with.
I do want to ask a few questions to follow up on that, Dr. Garg. I'm a parent. I've taken my kids to many, many pediatric visits, and you get the questions of, do you wear your helmet when you ride your bike, and do you use your seatbelt? And I love those because I feel like in many times that's directed not only at my child, but probably me as the caregiver as well. The wink, wink, nod, nod. You are doing these things, right? Tell me a couple questions that would have that same multi-direction, for both your patient, who is the child, and the parent, that are more leading to these, more larger issues that perhaps aren't as easy to answer with just a yes or no.
Yeah, it's a great question. And I'm not sure I have the exact language to speak. I think when you go to your pediatrician, and when you go to your doctor, you want to feel like you're being listened to, like you're being heard, like the top priorities, the things that are really on your plate, that they understand, that they get it. And I think that's hard to do, but it takes a relationship to really develop that. And I think for all of us as physicians, having empathy, having humility, trying to understand not just those questions. And I've done that many times in my life where I kind of go really through those questions. I want to make sure there's a routine, it's in the electronic medical records, but really asking, the family, how are you guys doing? I know being a parent is really hard. I totally get it. I know during this pandemic, and I know that there's things that you can't control that affect your child and affect your family. Things like food and housing and heat. And I may not have all the answers, but I want to work with you, and I want to see if I can try to help in any way I can. Because my pediatrician did that with my mom, and with me, and that's I think the onus. I wish I had a magic script I could tell you, like, this is what we have to say to get there, but it's that feeling, right? It's that feeling of being listened to, being heard.
Alison, Dr. Garg said that you have, I know, a very multifaceted role with the center, but with advocacy is one of them. Can you break down exactly the different areas of the social determinants of health and the things that go beyond, like Dr. Garg said, of just your physical health? What else impacts you in this way that is so out of whack in this country?
Yeah, it's a really good question. I think, we know that up to 80% of health outcomes are dictated by the social determinants of health. And I think there's a variety of ways that adverse social determinants of health affect children and adults and their ability to be and stay well. And, some of the issues facing families that we see in the Worcester and Central Massachusetts area are not dissimilar from the issues facing children in the Boston area and other areas of the country. I think, Arvin mentioned racism and poverty as two main drivers. I think the other one we're seeing a lot in Massachusetts in particular, and in the Worcester area certainly, is housing. Food is also a major issue. Transportation, education, utilities. So there are a lot of these challenges that are facing families, but many of them um, are driven by poverty. And so I think really focusing on and addressing poverty as the root cause of poor health for many children and families is really important. And I think, we as public health leaders and advocates want to address these issues in the day-to-day lives of children and families, but also think about how do we resolve this on a more global level. And I think that's where the advocacy piece comes in. And how do we really start creating policies that will support children and families, expanding those policies that already do support children and families, and ensuring that no child is hungry or without a home, or without access to education. And I think, unfortunately, we see in one of the wealthiest nations in the world that this is a pervasive problem. And, our children are suffering the most.
Yeah, I couldn't agree more. And how we really came together is the notion of kind of financial stability being obviously a huge determinant of your health. You talked about a lot of those things, if you can't pay for food, if you can't pay for housing, pay for the utilities. And financial literacy, which is something, I think all three of us care about, is certainly not the answer to that. It doesn't mean all of a sudden money is filling your pocket. But what I've been so inspired by your work, and I think what we will continue to do together is that notion of putting a bit of the power in the child's hand. I think they are powerless, as you said, in a lot of those decisions. And by teaching them early the tools to make good financial decisions and to even just understand what those decisions are, is what we are really striving to do. And I'd love to, hear both of you, your goals on how to really bring this into your practice.
When we first met you, Jessica, and got engaged with the FitMoney group, I think the first thing that was so appealing to me is your approach to financial literacy. I think, in our work, we really try to ensure that any intervention or activity or program that we deploy, that we stand behind, is something that is not stigmatizing, it's accessible, it doesn't feel like we're singling out individuals because they are experiencing a certain adversity. And I think that, when I have signed on to Super Squad and really, used some of your tools, really seen that it's a very easy way for kids to get this education without it feeling like we're targeting individuals or families because of their income. I think when we envisioned this sort of pilot program of deploying Super Squad across our pediatric clinics, it was really for all kids. And, I think that, when Arvin and I first talked about it, one of the first thoughts he had was, if we could create a model similar to Reach Out and Read, but only for financial literacy. So instead of, or in addition to giving children a book when they get to their pediatrician, could we give them access to financial literacy? Because I think, as Arvin mentioned, pediatricians are a huge ally in the lives of families. And most families, even very low income families, they may not have providers taking care of their own health, but parents always have providers taking care of their kids. They always are going to the pediatrician. They're always making sure their children are up to date with their, appropriate vaccines and appropriate, medical examinations. And so it's a really great avenue for getting access to the entire spectrum of families.
Thanks, Alison. Yeah, I'm so impressed by FitMoney and the work you're doing, and how you can empower children to learn financial literacy and learn these skills that will benefit them throughout their whole lives. I wish I had it as a kid. I kind of wish I have it now. I could use financial literacy help myself. But I see pediatrics, just exactly what Alison said. I see pediatrics as a public health platform for us to be able to work and promote health for those most disenfranchised in our society.
We're so excited. I mean, so much of what we do as adults goes way back to things we've learned early on as children. And so much of what we do is behavioral, and learning, behaviors, hopefully good ones, about treating people with kindness, certainly decisions that you make. I think people are really now realizing, you probably knew this, obviously this is your profession, starts so much younger than you'd think. And the studies show that by age 7, you've really already had your financial behaviors and habits kind of formulated. Are you the big saver? Are you the big spender? What's that, kind of needs and wants kind of thought process? And children are not just little adults. And so we're so excited to be able to partner with your team who understand that and really do treat children differently. And that's how we are bringing our lessons to them. I love that you said fun, because that was our big intent. You mentioned accessible, Alison, and that's also another really important point. How do you always ensure that you're reaching your communities in ways that, not only their parents can understand and their kids? Just talk about how important accessibility is.
It's a really, really important part of the work that we do. I think there's a common phrase in public health of nothing about us without us. And I think it's really important when you're doing public health work that you are talking to your end users, you're talking to the community members and children and families that you're hoping to help. Because I think in general, you know, we don't always have the answers. And so we need to hear from children and families exactly what works, what doesn't, what needs to change from their perspective. And I think, we've been given a really great opportunity with the Child Health Equity Center, by our chair, Dr. Larry Ryan, to really go out into the community and speak with organizations and individuals that are living this life and experiencing adversity as we all are, and understand what would best support them and what would help build protective factors around the children in the central Massachusetts community, but also children across the country.
I guess one last question I have, which hopefully is a hopeful question, but Dr. Garg, you said 30 plus years in pediatrics. Do you see progress? I mean, we do hear so much of poverty numbers. I feel like they're not getting better, and we're still facing so much difficulty out there. But do you see any hope in your work? And perhaps it is working with young kids. I think they probably are the most hopeful bunch of us.
Yeah, that's what keeps me going is being inspired by the children I take care of, and the hopefulness, their resiliency, their ability to think outside the box, and the ability to have fun and to be optimistic. That's being threatened, obviously, to many children post pandemic, and so being mindful of that as well. But the essence of a young child, a young infant, is that sense of purity and joy, and that's what inspires me. Solving poverty is not going to be solved by the medical system, for better or for worse. This is really a moral issue. This is really a social policy issue that has been neglected and not been as resourced as it should be in our country for generations and generations. There's empiric evidence that countries that invest strongly in social safety net have healthier children and have healthier populations. There's evidence that the child tax credit that was enacted during the pandemic reduced poverty for children by 50% in this country, which was unheard of. But unfortunately, on January 1st of this year, that policy expired, and all of a sudden, millions of children became poor again overnight. There's evidence that investing in the social safety net and food and housing will improve children both in the short term and as they become adults, and they'll become more productive, more fulfilled, and will have made more contributions to our society.
Well, thank you so much for your work. I'm inspired by both of you and your commitment to empowering children with all the tools to hopefully have a long and healthy life. Thank you so much for chatting with me today, and we look forward to our continued partnership and continued work with you.
Thank you so much. We're so excited to be here. Thanks for your time.
Thank you.
Thank you for joining us today on the FitMoney podcast. Whether you're a caregiver, teacher, or student yourself, there's plenty of great K-12 resources to begin or continue your financial literacy journey at fitmoney.org. Visit the show notes for more from today's guests and financial literacy activities for the classroom, at home, or on the go. We'll see you next time, and until then, happy learning, earning, and saving.
The FitMoney podcast is presented by FitMoney, the leading K-12 financial literacy curriculum providing free, unbiased financial literacy resources. All opinions, products, and references during the show are not endorsed by FitMoney and are solely opinions of the individual. FitMoney does not claim any responsibility for external resources referenced during the episode. All FitMoney products and episodes are provided for educational purposes and are not professional advice.